Today, we're diving deep into a critical and life-threatening condition known as septic shock. By the end of this video, you'll understand what septic shock is, how it develops, and why it requires immediate medical attention. Let's get started. What is septic shock? Septic shock is the most severe form of sepsis, a condition where the body's response to an infection leads to widespread inflammation and organ dysfunction. In septic shock, this inflammation causes a dangerous drop in blood pressure, leading to severe organ damage and, if untreated, death. It's a medical emergency that requires prompt and aggressive treatment. Causes and progression. Septic shock begins with an infection, which could be bacterial, viral, or fungal. Common sources of infection include pneumonia, urinary tract infections, abdominal infections, and bloodstream infections. Here's a step-by-step progression. Infection. A pathogen enters the body and starts to multiply. Sepsis. The body's immune system releases chemicals into the bloodstream to fight the infection, causing inflammation throughout the body. Severe sepsis. This inflammation leads to blood clots and leaky blood vessels, impairing blood flow and depriving organs of nutrients and oxygen. Septic shock. The condition escalates as blood pressure drops drastically despite fluid resuscitation, leading to severe organ dysfunction and failure. Risk factors for septic shock. Certain groups are at higher risk of developing septic shock, including the elderly and very young. Their immune systems are often weaker. People with chronic diseases, such as diabetes, cancer, or kidney disease. Individuals with weakened immune systems, due to conditions like HIV/AIDS or treatments like chemotherapy. Patients with severe injuries or burns, which can provide an entry point for infections. Hospitalized patients, especially those with invasive devices like catheters, breathing tubes, or intravenous lines. Symptoms of septic shock. Recognizing the symptoms of septic shock early can be life-saving. Key symptoms include severe hypotension, a dangerous drop in blood pressure, altered mental state, confusion or disorientation, rapid heart rate, known as tachycardia, rapid breathing, known as tachypnea, extreme pain or discomfort, often described as feeling very ill, clammy or sweaty skin, a sign of poor blood circulation. In addition, you might notice symptoms related to the underlying infection, such as fever, chills, and difficulty breathing. The pathophysiology of septic shock. Let's take a closer look at the pathophysiology of septic shock. Immune response. When an infection occurs, the immune system releases cytokines to fight the pathogens. In septic shock, this response becomes excessive. Cytokine storm. The overproduction of cytokines leads to widespread inflammation, causing damage to blood vessel linings. Vasodilation and leakage. Blood vessels become leaky and dilate, leading to fluid loss from the bloodstream into surrounding tissues. Hypotension. The combination of fluid loss and vasodilation results in a significant drop in blood pressure. Organ dysfunction. Reduced blood flow and oxygen delivery to organs cause them to fail, which can quickly become life-threatening. Diagnosis of septic shock. Diagnosing septic shock involves a combination of clinical evaluation and laboratory tests. Doctors will monitor vital signs, check for low blood pressure, high heart rate, and rapid breathing. Order blood tests to identify signs of infection, inflammation, and organ damage. Perform imaging tests, such as X-rays, Connecticut scans, or ultrasounds to find the source of infection. Other laboratory tests are depending on the suspected infection, such as urine tests or wound cultures. Treatment of septic shock. Treating septic shock promptly is critical to improving outcomes. Treatment usually involves antibiotics to combat the underlying infection, typically started immediately after blood cultures are taken. Fluids. Large amounts of intravenous fluids are administered to maintain blood pressure and ensure organs receive enough blood. Medications, such as vasopressors to constrict blood vessels and increase blood pressure. Other medications might be used to support heart function and address symptoms like fever and pain. Supportive care. This can include oxygen therapy, mechanical ventilation for respiratory failure, dialysis for kidney failure, and close monitoring in an intensive care unit. Septic shock is a serious and life-threatening condition that requires immediate medical intervention. Understanding its causes, symptoms, and treatments can help save lives. If you or someone you know shows signs of septic shock, seek medical help immediately. Thank you for watching. If you found this video informative, please give it a thumbs up and subscribe to our channel for more health and science content. And don't forget to hit the bell icon to stay updated with our latest videos. Stay healthy and take care.